You're listening to Bark and Wag's 15-Minute Vet Talk. Each week, your host, Polly Requa, interviews veterinarians and individuals in the pet industry from across the nation answering pet questions. Bark and Wag podcast is produced weekly for your enjoyment, and show notes can be found at barkandwag.com under the podcast tab. That's BARKNWAG.com. Please remember to subscribe to Bark and Wag 15-Minute Vet Talk.
Thank you for listening to Bark and Wag 15-Minute Vet Talk. Bark and Wag is dedicated to protecting our dogs through advocacy, education, and supporting like-minded dog lovers by selling custom pet products. Bark and Wag is excited to announce our new partnership with a Colorado hemp farm to produce a line of CBD products for your pets. Bark and Wag has CBD pet tincture available in 300, 750, 1200, and 2400 milligrams. Bark and Wag CBD is pet safe, no THC, it's made in the USA, and is CO2 extracted. Please check out Bark and Wag's website, barkandwag.com. That is BARK, to see our line of CBD and awesome merchandise. We love pooch ideas for podcasts and merchandise, so anytime send an email to Polly at barkandwag.com with your suggestions.
Welcome to Bark and Wag 15-Minute Vet Talk. I'm your host, Polly Requa. Today we're talking to Dr. Rebecca Windsor, veterinarian at Wheat Ridge Animal Hospital in Wheat Ridge, Colorado. Welcome. How are you?
I'm good, Polly. How are you?
I had a question from a listener that heard your podcast on what NME and PDE is, and they wanted to know, how do you tell if your pug is fat?
That's such a hard question, Polly. It's hard. They're stocky to start with, so I always joke with them that I feel like they carry all their weight up through their arms and their shoulders. They're so stocky. They'll have these smaller back legs and these really stocky front legs. And so, I think one way to be able to tell is we're obviously looking at a difference between fat and muscle, right? And so if we're just dealing with a kind of more robust, stocky pug, then most of that should be muscle, right? So when you feel them, you should feel like a firm, muscle substance kind of around the shoulders and neck area and stuff. The difference with fat is that it's going to be a lot more freely movable. So if, for example, if you take your pug and you're taking, a kind of a feel towards the chest area on the side there, if you're able to take a lot of skin there, and yes, they have a lot of skin to start with, but usually there's going to be a pretty thick fat layer under the skin in pugs that are going to be overweight, right? So if you have an excessive amount of tissue kind of at that level, or even if you try to kind of just very gently put your finger kind of on the side there, if you're finding like, hey, I'm having a really hard time feeling the ribs, then probably your pug is a little bit overweight because they're distributing fat in a place that they shouldn't be. What's tricky with pugs too is that because they are prone to a lot of other diseases that might make them being on the thinner side of things advantageous, sometimes you almost have to go into it with the goal of trying to keep them a little bit thinner. So for example, as a neurologist, I see them being prone to a lot of back issues. And so they can be prone to disc issues or changes with the way that their bones were formed when they were born that makes it a little bit more curved. They can get other kind of chronic diseases that affect the nerves in the back. And so I always tell my pug families that if we can keep them on the thinner side of things, it just means less weight that they have to kind of carry around, on their backs. And then the other issue that commonly is kind of related to their airway. And so they're so smushed based, they have so much tissue kind of towards that front part of their head. And so what happens is that a lot of that tissue gets kind of crammed into a small area. And so pugs are known for having big, beautiful tongues. And the problem is that tongue can be a little bit big in the back of their throat. And then they're prone to having excess tissue kind of in their back of their throat too that can make their airway smaller. And so it means that there's a smaller space for them to try to get air in. So what I usually tell people, it's like if you're trying to breathe through a straw, right? And so if you're really cardiovascularly fit and you have less weight to carry around, it's a lot easier to breathe, right, than if you are a bit overweight. And so for those particular reasons, we always kind of recommend keeping, pugs on the thin side of things when possible. But again, there's going to be a distribution of their weight where because they are so muscular and stocky kind of in the front, sometimes they can be misinterpreted, as looking like they're fat or overweight when they're really just muscular. Does that make sense?
So I'm going to go with muscular.
Yes.
With our last pug, I think they are like breeding pugs a little bit different. Mm-hmm. So Chuck the Pug Senior was just huge. I mean, I think he almost weighed like 28 pounds.
Yep.
And our current pug, weighs 20 pounds. And when Chuck would sit, he would just have these folds. And this little girl at the park came up to him and started touching his back and said, "What are all these scrunchies?" It was really cute. So,
the head and face, like that's not fat, right? That's just excess skin there. And I will agree with you. I feel like there has been a transition over the years of pugs getting smaller, where it's kind of rare now. I have a couple pug patients that are, 25, 30 pounds, like bigger, longer pugs, but a lot of them are very petite, and so I think because of that, we are getting a little bit more of the airway issue to some degree, and they have a lot of excess skin folds, right? So if you have a lot of excess skin kind of around like the head and neck area, that's not going to be fat versus like distribution that makes them look wider, you know what I mean? Is going to be more of like an issue, but if that makes sense. So,
well, even our current pug is smaller, but I still have to buy medium Halloween costumes and harnesses. I mean, because that girth is so wide.
Yeah.
So,
and stuff. And a lot of that is like bigger chest cavity, bigger neck muscles, so those are all just structural anatomic things about pugs that make their body look that way. And that has nothing to do with fat. You know what I mean? That is just based on the way that their rib cages and stuff are. So.
Sure. Well, thank you very much for the tips and being on the podcast. We look forward to having you back.
Great. Thank you so much, Polly. Appreciate it.
Thank you for listening to Bark and Wag's 15-Minute Vet Talk. If you like what you just heard, we hope you'll pass along our web address, www.barkandwag.com, to your friends and other pet owners. Have a pressing question for a veterinarian? Ask your question at barkandwag.com under the podcast tab. This has been a KFR production. Join us next time for another edition of Bark and Wag's 15-Minute Vet Talk.